Okay, now let's talk about Chapter 20, cholinergic drugs. Cholinergic drugs are drugs that stimulate the parasympathetic nervous system, so the PSNS. The parasympathetic nervous system is the opposing system to the SNS, or sympathetic nervous system. This is the rest and digest system, also known as cholinergic agonists or parasympathomimetics. They mimic the effects of the parasympathetic nervous system and their neurotransmitters, which in the parasympathetic system, that is acetylcholine. So we need to make that connection between parasympathetic is acetylcholine and sympathetic nervous system we already spoke about. Two types are determined by location and action once stimulated. So cholinergic receptors include nicotinic receptors and muscarinic receptors. Can't talk today. The nicotinic receptors are located in the ganglia of both the parasympathetic and sympathetic nervous system. They're named nicotinic because they can be stimulated by the alkaloid nicotine. The muscarinic receptors are located postsynaptically in the effector organs of the parasympathetic system. They are found in smooth muscle, cardiac muscle, and the glands. They are named because they can be stimulated by the alkaloid muscarine. The mechanism of action is they are direct acting or indirect acting. So for direct acting, they bind to cholinergic receptors and they activate them. In indirect, they inhibit the enzyme acetylcholine, which breaks down ACH, resulting in more ACH available at the receptors. Indirect are either considered reversible or irreversible. So in reversible, they bind to the cholinesterase for a period of minutes to hours. In irreversible, they bind to the cholinesterase and form a permanent covalent bond. The body must make new cholinesterase to break these bonds. So one acronym that could be helpful in remembering this process is sludge. Sludge equals stimulate too. Remember that. Sludge equals stimulate. So you're going to see a stimulation in saliva, stimulation in lacrimation, stimulation in urinary incontinence, stimulation of diarrhea, gastrointestinal cramps, and emesis. So we're going to stimulate once again the intestine and the bladder, so you're going to have increased gastric secretions, increased gastrointestinal motility, increased urinary frequency. Stimulated pupils, they will constrict. You will see meiosis, reduced intraocular pressure, an increase in salivation and sweating. Cardiovascular effects include a decrease in heart rate because of vasodilation. Respiratory effects, you're going to see bronchial constriction and narrow airways. Direct-acting drugs reduce intraocular pressure. They are useful for glaucoma and intraocular surgeries. Those include acetylcholine, carbachol, pilocarpine. Topical application, because of poor oral absorption, is usually used. Direct-acting drug bethanechol increases tone and motility of the bladder and GI tract. It relaxes sphincters in the bladder and GI tract, allowing them to empty. That's helpful in post-surgical atony of the bladder and the GI tract, or it's usually an oral dose or sub-Q injection. Indirect acting drugs are usually used, these are usually used in treatment of Alzheimer's disease. These ones include donepezil or Aricept and Exelon or Reversible. You also have Namenda or Mementine. This one is not a cholinergic drug. It is also used in treatment of Alzheimer's disease, though. Herbal products. So let's talk about Gingko. Common uses: organic brain syndrome, vertigo, and tinnitus. May cause GI upset, headache, and bleeding. Potential interactions can be with aspirin, NSAIDs, anticoagulants, and anticonvulsants. There are others as well. Atropine is an antidote for cholinergics, and it should be available in the patient's room for immediate use if needed.